The topic today is regenerative medicine, which is mainly going to be on adult stem cell therapy and platelet-rich plasma therapy. I will also be showcasing some of the new possibilities. I'm going to start by going over the goals of this presentation. And this is all about creating awareness about regenerative medicine. And that is adult stem cell therapy, platelet-rich plasma therapy, and like I said, I'll also be talking about some new possibilities in terms of diagnosis and dietary supplements. Regenerative medicine is very broad. But I can't go over everything. So I will only focus on adult stem cell therapy and therapy today. It's also important that at the end of today's presentation, we have an idea of what medical conditions can be treated, and of course, you see some of our good stories. One of the important take-home message today is to understand that time is of essence. The earlier, the better, and the less expensive, because you end up needing a less number of treatment sessions. Is this safe? We're going to go over that. Adult stem cell therapy is very safe, unlike the embryonic stem cells, which most countries don't allow. So that's not what we're talking about. There's no promise of cure. I repeat, there is no promise of cure. Yes, some of the testimonials may look like cure. What we promise is that there's going to be incremental improvement that current orthodox medicine may not be able to offer the patient in some cases. And of course, if we can reduce medical tourism, one patient at a time, that is going to be very great. So what is regenerative medicine? According to Mayo Clinic in USA, it is been defined as a game-changing area of medicine where there's potential to fully heal damaged tissues and organs, offering solutions and hope for people who have conditions that today are beyond repair. So it comprises platelet-rich plasma therapy, that is using your own blood, that is already very common, okay? And also stem cell therapy. Like I said, it's broader than these two, but I'm going to stay with just these two for today. Under stem cell therapy, there are three major types, and that is embryonic stem cell therapy, induced pluripotent stem cell therapy, and adult stem cell therapy. And adult stem cell therapy is what is clinically safe. And that is what we're going to be talking about. And that's what we practice at our centers all over the world. First of all, let's start with regenerative medicine in terms of adult stem cell therapy. So we're going to be talking about fat, bone marrow, and umbilical cord stem cells. To have a better understanding, I know some of us already know what stem cells are, but for the benefit of those who may not, a stem cell is any cell that can self-renew, multiply itself, and then at one time differentiate into matured cells. In the lab, these stem cells can differentiate into any organ or tissue of the body when they are being put in certain condition. We call it culture condition. But in real life, in reality, that's not how they work. Once they are being transplanted into anyone, the stem cells, they flow around the body. Anywhere blood supply reaches, the stem cells will reach there. If there's something wrong with an organ or tissue, the stem cell keeps circulating. But if there's a problem, degeneration, inflammation, or any kind of issue going on, there's what we call paracrine effect. That is cell-to-cell communication. So these stem cells, they produce signals to induce changes in the damaged nearby cells. Therefore, the cells that have not been repairing itself adequately will now start repairing itself in an accelerated way. So, in other words, regardless of the number of medical conditions that a patient is having, as long as there's a problem, inflammation, there are signals on the abnormal cells in the body that attract the signals on the transplanted stem cells, which we call home effect. So all these conditions will get treated. And if there's nothing wrong, they still have the anti-aging effect on the body. And there's even stem cell enhancer, which I'll be mentioning. That's one of the new possibilities, which is good for anti-aging. We'll talk about that soon. Before we get too deep into this, let us understand the three types of stem cells. The embryonic stem cells is considered unethical. It is not allowed by most countries, and it is only restricted to certain centers, even in USA, where I am based. And the reason or the logic behind it is that the sources of these stem cells are embryos that are collected from IVF clinics. These are potential human beings. So that's why it is considered unethical messing with potential human beings. But they are very powerful, and that power is sometimes referred to as being pluripotent. So the scientists decided that, okay, let's find a way, an ethical way, to get the stem cells with the same pluripotent effect. So they now call the second type of stem cells induced pluripotent stem cells. This is when the scientists take maybe white blood cells or the skin cells, they reprogram it, they culture it to express that powerful pluripotent characteristics of embryonic stem cells. So it's still in research. So in other words, when you hear somebody saying stem cells is not ethical, they are correct. If another person says stem cells is in research stage, that is not yet available, they are correct. If other people now says, no, I have stem cells for my children, either in India, China, or whatever, or USA, they too are also correct. Those that say that stem cells is being used for their relatives or themselves, they are talking about adult stem cells. And that's what we too are talking about. And adult is not about age. It's about fully formed human. That is why umbilical cord stem cells or exosomes that are also from either umbilical cord or placenta, they are being grouped under adult stem cell therapy. So for adult stem cells, there are many sources, but 4 major sources. Of the 4 on the screen, 2 can be from you, which doctors we refer to as autologous, and the other 2 sources are from other people, and that is allogenic. So from you will be your bone marrow or the fat in your stomach. At some point in the early stage, I used to joke that it may be very lucrative to be fat because you'll be able to donate your fat cells for stem cells for other people. That is possible, but practically it's not being done. So don't let's get too excited about that. And being overweight has some medical risk. So please don't quote me that I'm promoting to be overweight. For umbilical cord stem cells, these are being collected from mothers that have been tested, that have agreed to donate the umbilical cord of their babies. And also, it has to be from a clean C-section, not vaginal delivery. Exosomes can be from bone marrow. Pretty much exosomes can be from any cells because they are very tiny particles that are smaller than a cell, and they carry the information needed to promote regeneration in the body. So again, your fat, your bone marrow from you, exosomes and umbilical cord stem cell from others. Yes, nowadays, if a mother is giving birth, they will ask if they want to donate, or sorry, if they want to keep the umbilical cord of their children. But in Africa, we are still skeptical about that. You go and bury it under a tree or somewhere. The mothers and fathers in the house, you know what I mean. So what can be treated? Pretty much. Honestly, it is easier to list what cannot be treated, even on my fingertips, than telling you what can be treated. So pretty much anywhere there's tissue degeneration, adult stem cell therapy can offer hope. When we doctors even know the diagnosis, and when we don't know, adult stem cell therapy doesn't know whether we got the diagnosis right or wrong. It will still, if there's anything wrong, it tells the body after it has been transplanted to start regenerating itself. Yes, there's a mutation. Let's say somebody break their bone, you apply adult stem cell therapy, it will heal. But if the bone that is straight and broken down being bent, and you apply adult stem cell therapy, that is how it's going to heal. So in other words, in some cases, you need orthopedics, for example, in terms of this fracture I'm talking about, to realign the bone, which will heal, but you can use adult stem cell therapy to accelerate the healing process and shorten the duration of downtime. It doesn't kill viruses like hepatitis or HIV, but it does accelerate the repair of the damage to the liver or boost the immune system of HIV patients. It's been difficult to get patients with glaucoma to get good response. So like I said, there are some limitations, but in majority of cases, there is now hope that we doctors could not offer you before. So that's the beauty of it. It is very, very, very good for autoimmune diseases. When regenerative medicine started, the focus was, it can regenerate. Adult stem cell therapy can regenerate many organs. But only to find out that it's even more powerful for autoimmune disorders, whether it is rheumatoid arthritis, Crohn's disease, lupus, and even autism, that is multifactorial. We don't even really know the cause. It's a broad spectrum. So it does have improvement for that as well. Multiple sclerosis. Diabetes type 1 is autoimmune disorder. Type 2 is not. It can help in both cases. For heart conditions, heart attack and congestive heart failure are the two major conditions of all heart conditions that have been known or shown to benefit from adult stem cell therapies. Stroke, you see some case reports, and then cerebral palsy, which is more like stroke in children, all those things will respond. Sexual function improvement, and in both male and female, that is piece of cake. Arthritis also respond well. Neck pain, back pain. There's some conditions that are still not perfect. Things like Parkinson, you will need multiple sessions. Like the stem cell enhancer that I'm going to be talking about, it has shown to really help Parkinson patients. But when you understand the mechanism of how this one works, you will see why, you use stem cell enhancer, you get better results than just using only adult stem cell therapy. Neurological disorder, it works as well, especially at the acute stage. Acute means the time from the injury to the time for the treatment or diagnosis is very short, just some weeks. And like I said earlier, there's nothing wrong. You can use it to prolong your telomere. Telomere is more like the length of your chromosomes, and the longer it is, the longer you're going to live. And then it rejuvenates the body. It makes you feel better, look younger, and then live longer. That's why we use the word anti-aging. We already spoke about keeping marriages, keeping relationships. So the man or the woman doesn't have to worry anymore. All these things on the screen can be taken care of. Is it safe? The answer is yes or no, and no. You are talking about embryonic. The answer is no. It's not allowed in many countries. If you are talking about induced pluripotent stem cell therapy, it used to be no. Now it is yes, because the scientists have moved into human clinical trials. When you talk about somatic stem cell therapy, which is adult stem cell therapy, that has been proven to be safe, clinically proven to be safe. That's already, going on. And actually, bone marrow stem cell therapy has been going on since 1968. We just did not call it then bone marrow stem cell therapy. It was pretty much called bone marrow stem cell transplantation. Bone marrow transplantation, sorry. So now talking about the safety, the embryonic stem cell, like I said, is very powerful because of that. It keeps multiplying. So because of that, it is considered not to be safe. The midline iPSCs, the induced pluripotent stem cells, the scientists believe they can contain how it multiplies. So they're going to human trial. The somatic stem cell therapy, which is the column on the right side of your skin, has limitation on how it multiplies. That's why we're using the word multipotent. That limitation is actually a positive thing, because that's now what makes it to be safe. That's why it doesn't form all the cancers, the teratomas that are associated with the other types of stem cell therapy, and it is considered to be ethically safe. So we've spoken about bone marrow, fat, umbilical cord. Now let us talk about exosomes. I've already defined this. So exosomes, they are very small, like I said earlier, very tiny, and they control the stem cell communication. Every cell produces it, but the important ones are the bone marrow, the placenta stem cells, and umbilical cord cells that are producing these exosomes. Because they are so small, they are nano-sized, but they do contain the messenger RNA and the proteins that actually do the job for regeneration. So there are proteins in them and growth factors. They are smaller than nucleus and they don't contain nucleus, but other cells have nucleus. And last but not the least is platelet-rich plasma. That's when your own blood is being used. And this is already popular almost everywhere in the world, even in Nigeria here. That's when you draw the patient's blood, you process it in a proprietary way to get a result. There are different generations. The earlier generations are not really effective, so they're more okay for cosmetic. So somebody tells you that the therapy they had maybe for joint pain worked, and another one tells that the therapy they had did not work. It all depends on the kind of system, equipment, and the proprietary way that clinic is using. So you can get different results. Okay. And day-to-day work like stem cells, they stimulate multiplication of cells and therefore draw stem cells to where you put it, and there's tissue regeneration. It's many places in US, many places in Nigeria using PRP. What can be treated? Many things. If you can touch it, you can use PRP. If you cannot touch it, you need stem cell therapy. Anytime I say stem cells, I mean adult stem cell therapy. Please take note. So cosmetic, sexual function, wound that will not heal, your hair thinning, orthopedics, knee pain, joint pain, many things. Now about the new possibilities, I already mentioned dietary supplements, some new diagnoses that have even been treated. In terms of the dietary supplement, I'm talking about stem cell enhancer. All natural ingredients is being used, for many years. Clinical data is available on the efficacy, because it is, it features scientifically proven proprietary blend of highly concentrated botanical bioactives that have been documented to stimulate the release or migration of stem cells. because it is these are US products that are being formulated for physicians to support tissue repair as part of the management of various health. Why are they effective? Because they stimulate the release of more stem cells from bone marrow. So more stem cells contributing to tissue repair. And this helps to regain and maintain our optimal health. And again, in all types of stem cells, there's nothing wrong. You get benefit of anti-aging. Now, let me just say one more thing again. The stem cell enhancer can release up to 10 million bone marrow stem cells per day, and that's almost 300 per month. God created us to heal ourselves. What the enhancer is doing is mobilizing more stem cells from our bone marrow into circulation. So a simple way to kind of visualize that is if you cut yourself by mistake, let's say you cut your arm I take that back, you cut your skin, while cooking in the kitchen, you put pressure to stop the bleeding. Let's say 5-6 days later, it healed, the scar formed. When you have more stem cells circulating, it might take you 2 days. So that's why you boost your immune system, you accelerate your repair, regeneration ability, instead of going for procedures all the time. And if you do both, you even get better result. So pretty much that is my basic introduction and explanation of what regenerative medicine is. And now let's go over some testimonials.